Okay, everybody. So we are going to get started. My name is John Owens, and I work at FLIPS, Finger Lakes Performing Provider Systems. I am the support services manager here, and I am going to be presenting today on our Career Pathways Training program, the CPT, which is pretty awesome, as you all will pretty soon find out. So I have been here since February. Great place to work, and excited to share the details about our program with all of you. I will take questions throughout the presentation. I like it to be more interactive instead of holding questions until the end. So feel free to raise your hand or even just ask the question in between slides, in between things that we're talking about. Um, I want this to be more of a discussion as well. Okay. All right. Next slide, please. So here's the agenda. All right. Thank you, Alaka. All right. So we have four strategic pillars at FLIPS: community programs, supporting partners, care management, and workforce. Today, we're going to be focusing on the workforce pillar. What we do with the workforce pillar is we're trying to strengthen the healthcare workforce with workforce programs, and that's what this program is intended to do, the Career Pathways Training Program, CPT. As a New York State designated workforce investment organization, WEO is what we like to call it. But of course, acronyms are silly if you don't know what they mean. So that is what it means. We are focused on strengthening the healthcare workforce through programs and services that diversify the healthcare workforce pipeline and provide opportunities for those who may not otherwise have them, while also supporting the community's economic mobility. So this is where we're trying to increase the workforce in these fields and these positions and jobs, among others. So these are the schooling opportunities that we are providing to students. Next slide. Okay, so we are going to focus today on the career pathways training piece of that pie, piece of that puzzle, which is again in strengthening the workforce. Those are the other fields that we work with at FLIPS that we try to help with, social care networks and population health. But this is today, and what the CPT is about strengthening the workforce. So we provide repayment for healthcare professionals, fund education and participant support services to provide education and professional placement supports. And I will get much more into that in detail soon. So thanks, Alonka. Okay, so this is the waiver budget, the waiver that we were just discussing briefly. That's how much money came from the state, $6.9 billion. So $645,750,000 went to the Career Pathways Training Program. So remember, I mentioned the WEO earlier, the workforce investment organizations that I talked about earlier. There's three of them. So our region is one. There's a region more towards central New York, Syracuse, Albany, that kind of area and region. And then there's New York City region. So we basically, that 645.75 million, that money was split up between our three regions to help with the CPT program. So here's the federal impact on our waiver. So CMS published the federal position on the waiver, indicating that they will no longer approve this funding. The good news is that New York State confirmed that CMS will continue to honor the terms of this New York State Department of Health funding through the remainder of the demonstration period, which is through March of 2027. For all intents and purposes, what the date that y'all want to keep in mind is you need to graduate by the summer of 2027. So by May or June of 2027, your programs have to be finished and you have to be graduated by that time. That's when our funding runs out, and that's when we cannot continue to pay for the tuition, books, scrubs after that date. Okay. So what happens is we have some programs such as nurse practitioner and PA, physician's assistant, that we don't even offer anymore as options because those would not finish by May or June of 2027, if you know what I mean. So those aren't even on the table anymore for students to do those through CPT. And of course, we can talk about all of those programs later, any questions that you have. Good news is that we are going to keep the waiver. We are going to keep this funding through the end of the allotment of time that we were given in the very beginning. So that's very good news. Okay, so here are the three WIOs, the workforce investment organizations that we were talking about earlier. The first region is the New York City region, Hudson Valley, Long Island, and it's those counties there. Region 2 is the southern tier, Central New York, the capital region. Many, many more counties there. However, the counties are a little bit smaller, so that's why there's more counties in that region. And then our region is the Finger Lakes region, Western New York, Region 3. And those are the counties that we serve. So in other words, you have to have an address in one of the counties in our region to be able to qualify for the CPT funding, or you can live in one of the 5 bordering states that border New York State, but work in one of those counties, one of our counties there. And if you, for example, worked in one of the other counties in one of the other regions, we would send you to them for them to be able to help you. But that's how these are set up in our state. And those are the counties that we work with students and providers with, is Region 3 and those counties. Okay, the Career Pathways Training Program. So it was created to address statewide workforce shortages. What this program does is it provides tuition, and we pay tuition, the educational expense payments, and we provide support services, tutoring, mentoring to students to help them along the way. We have case managers, we have case management that we provide for every student that goes through our program. Every student will have a case manager. Some students will also have other supports if needed, depending on how they're doing with their grades and with other things. But the thing to know is that we want all of you to succeed. So we don't want you to not succeed. So we're literally all in this together. So we want you all to be successful, for you all to succeed, for you all to get your degrees, and then for you all to move into the workforce for 3 years after you graduate. And that's the next part of the program that I will talk about. But the CPT program is for new careers, but it's also for career advancement. You could already have a career in nursing, but you want to advance in a different career in nursing. So you go back to school, and while you're working, as long as it fits and as long as it fits the time frame. So this program targets high demand shortage areas, reduces barriers to career advancement, and supports marginalized and underrepresented communities to enter into and advance in the workforce. So what you guys will do is you will make a 3-year full-time work commitment in the professional title that we pay for the schooling for. You will have to work in that title for 3 years after you graduate. And you have until 2031 to complete those 3 years of work. Okay.
I have
So,
a question.
sure, go ahead, Sabrina.
So I'm trying to become an aesthetics. I mean, I'm trying to become an esthetician,
Okay.
and I wanted to further my education by becoming an RN so I could do injections on people.
Okay.
Would that still apply, or can I just work under my original degree I'm trying to get and just have that, still have that because I want to apply it anyway?
Yeah. So if you were to go through the RN program with us while keeping that other job, you would have to work as an RN after you graduate for 3 years. Does that answer your question?
Yeah, so I would have to do both careers, basically.
No, no. You would the only requirement that our program requires is that you work as an RN. If you get the RN degree from us or through us, you have to work as an RN for 3 years in New York State. We do not require you to have any other jobs. So,
Okay.
okay, good question. Okay, the other caveat to the working is the place that you end up working at has to be one of our providers. In other words, they have to fill out an attestation with us and they have to be basically under our umbrella of employers for you to be able to work at. What the employer has to do to qualify to be one of our employees is they have to serve at least 30% Medicaid or uninsured individuals. So, in other words, when you graduate from whatever field it is that CPT paid for and you go into the workforce, the place you go work at has to serve at least 30% Medicaid and or uninsured.
And I'm
And if
assuming there's already employers affiliated, correct?
what's that, Beverly?
There's already employers you have affiliated, correct?
There is, yes. Yep. I think we're getting close to 100 employers. Um, but I can let Casey or Kathy, who are on the call, speak to that. I think the last I knew, we had you know a good amount of employers. We're going to post them when on our website fairly soon, I believe. Once we get a good number of them and hear back from many that we're still waiting to hear back from, we didn't want to post them earlier because we didn't want participants to think those were the only providers we were going to have. So, Casey, would you like to speak on that a little bit?
Sure. Thanks, Jen. I think you did a pretty good job.
Okay.
And you are absolutely correct. We have almost 100, and we are evaluating where all of our current participants work. We'll be reaching out to all of those providers. And we just have to run it by the state because they have to meet certain guidelines. And so once we do that, we get approved and then they'll be posted to our website. We expect to be covering the entire area. We have at least 300 more in the works right now. So yeah, we should have a really good amount of job opportunities post-graduation.
That's
I
awesome.
have a
Thank you, Casey.
question.
Yeah, go ahead.
Hi, my name is Sid. I
That's it.
am in the RN program at Genesee Community College, and I live in Amherst, New York, which is in Buffalo.
Mhm.
And my unit manager just gave me the information a couple of weeks ago.
Mhm.
I work as an LPN at Erie County Medical Center.
Okay.
And what I was wondering is we started school end of August. Is it still time to apply for this semester?
So normally, Sid, this is only offered to people who have not started school yet. But what you can do is I'm going to have Alanka put my email address in the chat, and you can email me, and I will chat with some folks and see if there is any opportunities to help someone, in your position who just started a few weeks ago. But
Yeah, we're
normally we
three.
we we do not do that. Okay, so
Okay, thank you. We're 3 weeks in.
okay, thank you, Sid.
Thank you.
Yeah, and I'll find out for you, and I'll get back to you.
Thank you.
You're welcome.
Hi,
The other,
John.
yeah, the other thing I just want to quickly state about the employers is if you work at an employer that you would like to be one of our employment partners, you can have the employer reach out to us, and I'm going to have Alanka put in that email address into the chat. It's cptpartners@flips.org, but she'll put that in the chat. You have your employer reach out to that email, and then we will start, and do on our end what we have to do to try to get them attested and get them as part of one of our employers. Okay. Okay. Who has the question?
Hi, John.
Yes.
A question.
How do I say your name?
My name is Matika,
Hi, Matika.
and I'm calling out of Rochester, New York.
Okay.
I have a question about the graduation date and payment. So I'm interested in a program that I will be graduating sometime in 2027. I want to say June, June-ish. So if the program goes over June, I will be financially responsible for any said fees after June.
Yes, after that semester, after that, I think it's the summer semester. As of right now, yes. But what we do, Matika, is we don't accept anyone that's not going to finish by the end of that summer semester. So what would happen is our case manager will work with you and your school to try to figure out if your program will finish by that date. And if it will, then we will be able to approve your application. If it won't, then we would not approve it if it finishes after that date, if you know what I mean.
And that date will be June 30th, 2027?
It's just whenever, yeah. So the summer semester ends at different dates for each of the 50 institutions that we're contracted with, or 50 plus. So yes, it's either in May or in June, just depending on what the program is and what the school is that you apply to. But the case manager will go through all of that with you and work with you on a one-on-one basis to get all of that figured out ahead of time before you get involved with the program. Okay.
And John, I just wanted to chime in.
Yeah,
I think you said summer, but meant spring. So it's at the end of the spring 2027 semester when people graduate.
Yep. Okay.
I have a quick question. Sorry. So I'm going for the LPN program. If I receive my RN within the 3 years after I graduate with my LPN, would I still have to be an LPN for those 3 years?
So if you get the LPN with us,
Right.
and then while you're working as an LPN, you become an RN,
Right.
that would be up to the state. I don't know if Casey has an answer on that. What I would think is that you would have to fulfill your commitment as an LPN for 3 years. However, the state may allow you to work as an RN if you get the RN after 2 years of working as an LPN, or 2.5 years. But I'll let Casey comment on that if she has any thoughts on it.
Sure. This actually has come up, and you're pretty accurate, except you don't have to stay as an LPN as long as you're staying in the Medicaid facilities or the facilities that we have listed. And so if you're growing in your career as an LPN and then an RN, you would just work as an RN in one of those facilities.
Okay, that makes sense. Thank you. And I'm sorry, one more thing.
No, you're good.
How do I get my current employer who fulfills those, like we are 30%?
Yep. You just
how do
have
I
them
get
shoot
that?
an email. You just
What
have
do
them
I-
shoot an email to the email that Alanka placed in the chat.
Fantastic. Thank you so much.
Oh, you're very welcome.
I had a question about the 3-year commitment.
Okay, Jim.
So does that have to be like 3 consecutive years at the same location? Or let's say my availability doesn't work out and I want to switch to another location, but they still cover 30%.
Yes.
Like with that.
Oh, yes. As long
Okay.
as you fulfill the 3-year
3
work
years.
commitment within that time frame. And for some of these positions, you have to obtain your license after you graduate. So it's kind of a crunch, right, to get all of that in, because the thought process is if you if we do pay for all of your schooling and then you do start to go to work and you don't fulfill the work requirement, New York State may come to you to try to collect the tuition, all of the tuition that was paid for. Do you know what I mean?
Right.
So you
Yeah.
just have to make sure, do you know what I mean, that
Mhm.
you have it figured out that you can get the 3 years in time. But it's a great question. Yes, you could certainly switch employers for whatever reason if you had to.
Okay, and then my other question would be, I submitted my interest form and I received an email back to make, I believe it was called like goco.com
Yeah.
to create the account. And then it emailed me back and said that I had like, I don't know, something to sign, I think. But I don't see it anywhere on that website. I just see it in my email so far.
Okay. Either I will have someone speak to that, or you can just shoot me an email and I will get it figured
Okay.
out for you, Gianna.
Okay, thank you.
My email should be in the chat.
I have a
John,
question.
I might be jumping ahead, but I have a question to piggyback the Go website. So I registered mine too, and when I go through it, it is requesting the acceptance letter from the college of our choice.
That is
So we have
correct.
to be accepted before we have to be accepted to the school before we're kind of accepted to your program.
That is correct. So
Okay.
so your case manager will work with you. You'll have to apply for FAFSA. You'll have to apply for TAP. Your case manager will work with you on your acceptance letter. You can get the application from us to fill out before you have the acceptance letter, but you should be in the process of getting it, because you can't complete the application with us until you have the acceptance letter and you provide it to us. And once you do, then we can process the application. But yes, that's a very good question. You do need to have your acceptance letter.
I have another question.
Sure.
So you said it has to be when we work as, say I wanted to be an RN, if I wanted to work as an RN, I would have to be 3 years. And you said something like I would have to help people on Medicare or Medicaid.
You just have to work at an agency, at a business that serves 30% Medicaid or uninsured. But Sabrina, you won't have to figure that out. We will let you know who the providers are that you can work at.
Okay.
And then if you have one that you would like to be one of our providers that isn't, you would have them email that CPT partners email that Alaka put in the chat earlier, to see if they qualify.
It's because right now I'm currently in school to become an esthetician. I finish in December. And I wanted to become an RN so I could get my injecting license. I mean, start injecting stuff on people. But like I don't know.
Unfortunately, you would have to work as an RN though for 3 years, instead of just kind of getting that skill and then working as an esthetician, if I said that correctly.
Would I be able to do part-time or it has to be full-time? Like,
It has to be full-time. So you have to work 3 years in the title that we paid the tuition for 3 years full-time.
Could you still apply, like fill the application out?
What's that?
Could you still fill the application out for the CPT program?
So what are you asking? Anyone can fill out an application, but the case manager, what happens, Sid, is the case manager will work with you ahead of time, like before you even fill out the application, and let you know if you qualify, if we're going to be able to accept your application. Doesn't mean that we will, but just that you're able to. But in your situation is a little bit different. So I'm going to have you email me and I'm going to talk to leadership and we'll see if there's anything that we can do.
Okay, thank you.
You're welcome, Sid.
I'm sorry, and I had one more question regarding the due
You're good,
date.
Jim.
So online, I seen that it was due by the 1st of the month prior to you starting your program.
Yes.
So our program that I have here in Rochester, I'm going for my LPN, and they told us that we had to wait to get our acceptance to be able to even like apply for this. And we just heard back yesterday, Tuesday, but for the program, it starts on October 13th.
That's okay.
Okay.
Yep. As long as you get into our system,
okay,
get the pre-services done, get your application, you'll be fine, Gianna. What school are you going to?
Monroe Community College.
Okay. Sounds good.
We will be updating our website. That should be removed. Our apologies.
No, it's okay. I just wanted to make sure it was still an option.
Yeah,
Thank you.
it's a great question. Yeah. Okay, so those are the titles below that we talked about. And still, any questions, shout them out. And I will talk about the financial piece of it a little bit later, how we pay, when we pay, how all of that works, just so you guys know, in case you have any questions on that. So that little star there at the bottom says we're no longer accepting applications. It's for those two that I talked about earlier, the nurse practitioner and the physician assistant. Okay. All right, next slide, please. Okay, here are the details. So there are two kind of pipelines. When you first get started in the CPT, it's for people that are currently working in healthcare that they want to advance their career. And there's also a new careers pipeline for individuals who are not employed or are employed somewhere else but want to become a nurse or go into a different field, basically. Here are the important details. Funding is only available to new students. Individuals who have already started the program aren't eligible. CPT funding is scheduled, so our funding, the money that we receive for the grant, ends at the end of March in 2027. But like I stated earlier, any incoming students must be on track to graduate by May or June of 2027, because we can make that last payment by the end of March. Okay, if you guys know what I mean. Participants are required to complete 3-year full-time service commitment, like we already spoke about. So the participants will receive application and enrollment assistance. They will receive tuition coverage from us. Our money is the last money in. So if you have FAFSA money or TAP money that you apply for and that you get, that goes first, and then we pay the rest. Okay? Educational case management you will receive. We have amazing case managers at Flips that will help you literally from the very first step of you filling out your pre-services. After you fill out the intake, they'll help you throughout the entire program, throughout all of your schooling, and then even into when you going into the workforce. We offer tutoring and mentorship, apprenticeship services, and we also help to place you in employment after you graduate. So for employers, this just talks about backfill. It talks about your employers being covered for up to 2 days a week if you have to now miss a little bit of work because you're now entering into this program. But that's something you can ask about. You can talk to your case manager about it once you're accepted into the program, or even when you're thinking about being accepted. They can explain that more to you. Okay, next slide. And any of you, just so you know, you can email me with questions, specific questions to your accounts. Okay? All right. CPT program participant requirements. So you must be a U.S. citizen or an eligible non-citizen. You must meet all the educational and training requirements based on whatever title it is that you're applying for and the course study. So you may have to have prerequisites that are done. And we do not pay for prerequisites. Okay, so that's one thing, and that's a popular question that comes up. We do not pay for prereqs. You must be a New York State resident, or like I mentioned earlier, be a resident who lives in one of those 5 bordering states, but that you work in a facility in New York State right now. And then the last part is being committed to a 3-year full-time employment, like we've spoken about a few different times. Next slide, please. Here are the support services that we provide for the program participants. Case management, pre-training and academic program readiness, talking to applicants about what might be coming ahead for them in their programs, academic and training support, enhanced academic support, so we can provide individualized support with tutoring and with mentoring for students that would like or need the help. We help with job readiness, placement, and support after you graduate and you're ready to enter the workforce. We can also help with, our case managers can help with any kind of language barriers or services. And then we also can help leverage our partnerships that we have with other partners in the community to help support our CPT participants with any kind of non-academic services. Next slide, please. Okay. So the funds can only be used for those 5 category expenses there on the left, okay? And you guys can go through those. It's basically what I've talked about before. The main thing to remember is we cover tuition, we cover books, and we cover scrubs. And that's what we cover. There have been some situations where if you can purchase whatever the material is at the bookstore, there are some times when we cover it. The thing to know is that we cover required materials. We don't cover materials that are recommended or that are said that could be helpful to you. Those would be on your own expense, okay? Those are the things on the right-hand side of this slide that we do not cover. We don't pay for room and board. We don't pay for living expenses or meals. We don't pay for parking or transportation. We don't pay for laptops, background checks, vaccines, CPR certification, drug testing, or any kind of standalone processes that are not part of the tuition. Okay. Next slide. Okay. So this is what Casey was talking about earlier. We have a job vacancy dashboard where we use JobSpeaker as a platform to collect vacancy from all of those places that I had said to you that we're already attested with, like they're already our employers. We have a platform to figure out what needs they have, what job openings they have to be able to help and support you guys.
Hey, John.
Yeah.
Question about coverage.
Sure.
Do you guys cover licensing, testing, or anything associated with that?
I believe we do. I believe we do, but I'll let Casey or Kathy respond to that one.
Thank you.
Yeah.
Yes, we do.
Okay. I thought so. I just wasn't 100% sure, Matika, but yes, we do.
Thank you.
Of course. All right, next slide, please, Alanka. Okay, so this is your journey that you go through with CPT. So you submit the interest form, and that happens on our website, Health Careers Now /CPT or healthcareersnow.org/CPT. That's where you go to submit your interest form. There's a button midway down the screen that says interest form. You click on it, and that's how you get started with us. You then fill out what's called the pre-services. You answer a couple basic questions about what program you're thinking about, what kind of things you might need, and then you get assigned a case manager. And then that case manager helps you throughout the entire application process. After that, you'll get a participant agreement that you sign, that you agree to work for 3 years in the field that we're paying for, or that Flips is paying for 3 years after you graduate. So the payments are made by Flips, okay, by us. Let me just talk very briefly about that. So we make the payments to the institutions once your program and you at your program are 100% liable to pay the tuition. So for example, if I start on September 1st, my program, I'm not going to be 100% liable for weeks down the road. In other words, I can say, oh, this isn't for me a week in or 2 weeks in, and then just say, I'm going to drop out. I can't do it. I work too much. My kids, it's too hard for me grades wise. So we have not made any payments yet, and you would have to make any payments as long as you drop out before the liability is met. Once you students are 100% liable, that's when we make the payment. But just know that's usually 6 to 8 weeks into the semester. And then once the school invoices us, okay, sends us the bill, We then have another 60 days to pay the school. So if you think about it, and I just want you guys to know this ahead of time, it can take up to 4 months for the school to get paid, 3 to 4 months for the semester that you're just starting. So just keep that in mind. The other thing to keep in mind is if you have been accepted by us into the CPT program and you get a tuition bill, do not pay it. We cannot reimburse students for anything. Okay. So don't pay for your books. Don't pay for your scrubs. Don't pay for anything that we're supposed to pay for, because we may not be able to, we definitely can't reimburse you directly. And we may not be able to make sure that you get refunded for that. Okay. That's important to know and important to remember. And the other thing is, some schools may hold on to some other loans that you have for food or for housing or for whatever else you might need them for, and they may not release them until we make our payment. So you have to know that sometimes it's going to take a few months for us to make that payment, just so you guys know. Okay. All right.
I had a question.
You got it.
This might be silly, but regarding the LPN
No silly question.
program, regarding the LPN program, is it like, do I still apply for financial aid assistance?
You have to apply for TAP and you
Okay.
have to apply for FAFSA.
Okay, I
So
wasn't
that's a
sure if it was the same
requirement
thing because
from
technically
us.
I'm not obtaining like the like I'm not getting a degree, so I wasn't sure if I
Yeah.
still qualify for TAP and FAFSA. So apply for those first.
Yep. And,
Okay.
and honestly, your case manager can help you do that too.
Okay.
But to get ahead of it, yes, apply for them immediately once you know
Okay.
that you're going into a program and you know exactly what you want to do. You know what I mean, Gianna? Because
Okay,
the
good.
sooner you do it, the better.
Yeah. Thank you.
You're welcome.
Hey, John,
Can I-
would you
Yes.
to piggyback off of her question about FAFSA? My
Sure.
school does not accept FAFSA
Okay.
for the RN program or TAP.
That's
Is
fine.
that
Oh.
okay?
That is okay. Yep. Yep. You have to apply for them. And if the school doesn't accept them or you can't apply for them for whatever the program is, that's okay. And your case manager will walk through all of that with you.
Thank you.
You're welcome.
So my name is Asia. I have a question as well.
Hey, Asia.
What Gianna was saying, I am also a part of, going to be a part of the MCC LPN program, which starts in October. Approximately how long does it take for a case manager to reach out to you? Because I have set up my Goku account. I did the pre-assessments already, just waiting for someone to reach out. And I know we have to have this completed before we can officially move forward.
Yeah, Asia, you'll want to send me an email directly, okay? And Alaka put it in the chat, and I will make sure your case manager reaches out to you immediately.
Okay, thank you.
You're very welcome.
One more quick question, John.
Sure.
Is there a cap on the tuition or what school we can go to?
There is not a cap on the tuition. You can only go to schools that we are in contract with and that we have basically signed on as one of our schools. So, and those are listed
Okay.
on our website, and you can also get that information from the case manager. But yes, you have to go to one of the schools that we are affiliated with.
Thank you.
You're welcome. You can go to the next slide, Alonka. Thank you. Okay. So these are our enrollment numbers as of 2 days ago. So we have 1,574 enrolled students. That's pretty awesome. Those are the numbers that we have under in the specific titles on the right-hand side. Like we stated earlier, the two that are closed for new applications are the NP and the PA, the nurse practitioner and the physician assistant. Next slide, please. And look at that, right on cue. So here are the schools that we are in contract with. I'm not sure if this is every one of them, but I will tell you that we are approving new schools all the time, so which is really good, and adding on new schools. So you'll want to check with the case manager, whoever your case manager is, if you want to inquire about a school to see if we're either in the process of having a contract with them or not, if there's anyone specifically that you would like to know about. Next slide, please. Oh, look at that. All right. Questions and any comments, concerns, questions that you guys might have that I could help you with, maybe?
Quick question.
Sure.
I submitted my I forgot what you guys called it, but the
Interest form.
Interest form. But how soon do I get a response from that? Because I haven't gotten anything.
So when you fill out your interest form, it's kind of an interesting scenario. So you kind of fill out half of it, and then you get an email that sends you to finish the rest of the interest form. And then once you're finished with the interest form, that's when you get assigned a GoCo account. You go into GoCo, which is our system. You go down to workflows, and that's where you will have what's called your pre-services workflow that you have to complete step 3 on. But if you're stuck at any step, just email me and I will help you get to the next step.
Got it. I will check my spam because I didn't get an email after I submitted it. So
yes, and it happens immediately. It's not something that takes a week or 2. You know what I mean? Like as soon as you're done filling out what you're supposed to fill out in the interest form, you get the email right away. So
got it. Okay.
You're welcome.
Hey, John.
Yeah.
I have a question about academics.
Okay.
If we're not going to speak it into existence, but let's say you start failing out, and you're still financially responsible. What can FLIPS do to support us, and who will be liable for that bill if, things just wasn't going right for whatever reason?
Yeah, no, that's a great question. So while you're in school, working in whatever program it is, you will have extensive support from us, from our case managers. We have 2 different tutoring services that we provide. One of them is literally on demand. You need tutoring at 11:30 at night, you log in, you get it. Whatever time of day you need it. Another one is not on demand, but it's an awesome service that we provide. So we have 2 different tutoring services. You also will still have the services that the school provides. But Matika, for example, if you're in a program and you're in the first semester, and we get past the date where we make the payment, and then you end up not continuing later on down the road, or if you don't do well enough, you fail out grades wise, then technically you would be responsible for the money that we paid if you don't complete the program. Same thing if that happens in the second semester or the third semester. You know what I mean? We still don't know how the state is going to come back to reimburse those funds, but you just need to know that that is a distinct possibility. Okay, so if you start the program and then you don't finish it, or you don't finish the work requirement, or you don't pass the licensure, there's a possibility that the New York State would come after to try to recoup those funds from you. Okay?
So at the end of the day, I, the student, am still liable financially at the end of the day.
If you leave the program, yes. If you complete the program and complete your licensure and complete the 3-year work commitment, you are not responsible for anything financially.
I do have one more question. I think that'll be it for me.
You got it, Matika.
So I'm a graduate of Isabella Graham, and I got a scholarship from RGH for free education with a 3-year commitment. And so I am working now as an LPN, and I would like to obtain my RN. Does that have a factor on the 3-year commitment that I will have with you guys for the RN? Can I run that time like congruently, or would I have to fulfill the 3-year commitment prior to, or how does that work or go into play?
All right. So what I can say that I know for sure is while you're fulfilling the other requirement for the other program that you did, you can certainly start school with us. I mean, that I know for sure.
Okay.
What I don't know is for sure is once you graduate from us and you still have that other requirement to fulfill, another 6 months, another year, you may have to work both jobs full time, or you may decide to finish the other commitment you have maybe in the first year and then still have 3 more years to fulfill the commitment for us. Do you know what I mean? So,
Okay.
but that's something your case manager can talk with you through and work out with you. But it's an excellent question.
Okay, thank you.
You're welcome.
John, I have a question. In filling out the FAFSA and the TAP, and
Yep.
you guys chime in with payment after that, so we would be liable for the repayment of the FAFSA and TAP if awarded, correct?
If that's how those work, is that how those work, Casey? Are those just given, or are those loans that you have to pay back?
So so the CPT funding is last dollar. So that funding would be through the school. And so however that works, if you're getting like a Pell Grant or something like that, you generally don't pay them back. With the FAFSA and TAP, those would be between the school and you. And I can't speak to how all of the schools do that. So ours would come after that. So our amount would just be the amount that the CPT funded.
So Beverly, you would have to check with the financial office at your school in particular and ask them that question, because it is a good question.
Okay, thank you.
You're welcome. All right. Any other questions? And I can stay on if it's a question you don't necessarily want to ask in front of others, but all the questions are great questions. You help everybody learn too, asking them in front of everyone. So.
John, I think somebody is asking about some type of income gap or finance.
Nope. There's no qualification on income. Good question.
Well, I just would like to say thank you very much for this information. I am a returning older adult female, totally changing careers, had no knowledge, I'm a novice when it comes to nursing, and everything has just been falling right in line for me. So I'm believing like this is the path I should take. And and I found out about this. This is my third day on the job as an LPN, and I found out about flips from my charge nurse. And just so happened you're doing this presentation today. So I just personally want to say thank you. And I hope I can, fulfill requirements, because I do want to continue my education. But it's very expensive. So I'm grateful for a program like this. And I just want to say thank you for your time.
You're very welcome, Matika. In my experience, the folks that are grateful work hard, and they, you know what I mean, and they go for what they really want. And it's awesome that you're doing that. So you just keep doing a great job. And things, of course, you're welcome. And I work with a great team at Flips, by the way. They are all incredible. So, and they know much more than I do. So, go ahead.
I have to stop in one day. You guys are right in Rochester, so I'm in Rochester. Yes. So thank you.
You're welcome. What's up, Sid?
So wanted to say thank you also, even though I found out a few weeks after the fact, but I am also grateful. Being an adult student, trying to pay tuition on my own is very hard. But I am appreciative to learn about these type of programs that we had no knowledge of.
For sure. I promise you, Sid, I will go to the people that I work with just to see if there's anything we can do. I can't promise you anything, but I promise you I will go and I will ask the question. So
thank you.
And I will be in communication with you. You're very welcome.
Thank you.
Sorry, go ahead.
Oh, I'm sorry. I just wanted to ask a question when it was done with. If you don't mind, I'll just hang on.
Yeah, you got it.
Thank you.
Of course, Tanya.
So when when we send the email, because I'm actually in HR for my company, and I want to get us registered because we can benefit from all of these positions. Is it okay if I send the email if I'm also participating in it? Even though I'm in HR, like I can find somebody else to do it if you would rather me do that, but I just wanted to make sure.
Send the email about what?
About having our company participate, be one of the companies that
yes,
one
yes.
of the
You can
employers.
send
Okay.
That,
All right, perfect.
No, that's a thoughtful question though. Thank you. But yes, you can send the email.
No way.
Great question though. That's the first time I've had that question. Anybody else have any other questions, comments? Okay. Well, anyone that has any last second questions, I will hang out and stay here to chat with you. And I hope the rest of you have an awesome day. And good luck. And reach out to me if you have any snags or any issues.
Thank you. Have a good day. Bye-bye.
You too.
Okay, thank you. My name is Tanya Perry, and I work in human services in Buffalo, Erie County, New York, and Monroe, actually.
Okay.
I want to be sure, and I'm not sure. We've done grants through you. I work for People Incorporated. We've done grants through you, and I want to make sure that we're actually on the list to hire once the students go through. Now, I'm actually going from the RN to PSN program. That's what I'm going to apply for. But I'm also the person that would hire RNs, RNs, NPs. And so I wanted to make sure, because it never occurred to me to be a partner once the students are done for placement.
Yeah, I would reach out to that email unless someone is on the call from Flips that either knows or doesn't know if you're already affiliated with us. I would send an email to that CPT partners@flips.org, I believe is what it is. And they can either verify that you're already affiliated with us and have signed the attestation, or get you the attestation form to fill out and sign. Okay,
perfect. Thank you. It didn't occur to me, so I was listening and I'm thinking, well, I'm always trying to hire RNs, LPNs, NPs. And this is a great source. So I want to make sure.
Casey, did you want to say something? It looked like you had.
Yeah, Tanya, what healthcare system or hospital are you with?
It's People Incorporated in Buffalo, New York. That's our headquarters.
Oh, gotcha. That I don't believe that I have seen that come across yet. It could be in the works and I just haven't seen it. But if you reach out to that partner email, we will start the conversation with your team, and we'll get you signed up.
Well, I have nothing else, so I thank you for waiting around.
Oh, you're welcome, Tanya. No problem. Yeah.
All right, then. Take care. Great information.
You too.
Wonderful program. Thank you.
Cool. Thank you.
Take care. Bye-bye.
I had a question.
Okay. How do I say your name?
Eritrea says
Eritrea? Okay.
Yes. Someone had shared a little bit earlier, regarding like we have to fill out FAFSA first, like our financial aid.
Yeah.
And I think I read where it's like make sure you don't pay like any private loans. But just because it's been so long since I went to school, with the financial aid, I understand like Pell Grant, you don't have to pay it back. But isn't there like loans, even if with like FAFSA that like through the government that you do have to pay, even if it's not a private loan?
Yeah, I believe so. And that's kind of like what Casey was talking about earlier. You would have to check with whichever school that you're thinking about going to and see if that FAFSA tap, if you apply and then you're awarded one of those, if that is something that you're going to have to pay back. But you would have to ask. Unfortunately, we don't know those specific answers for each school. And then a private loan, yes, of course, you would have to pay back. But you could apply for us and then get funding from us and then not have to apply for that private loan for the tuition and for the books and for the scrubs. You could apply for it for other things, for room and board, for food, you know what I mean? Transportation if you needed to, but that would be kind of like you know, that would be your decision. So
So just clear, we have to exhaust all of our FAFSA first to
exactly FAFSA and TAP. Yep. So the thing to remember is kind of like Casey said earlier, our money is the last money in. So we will pay whatever bill is left over after the FAFSA and TAP, but we don't require you to take out personal loans or apply for private loans. So
okay, perfect. Thank you so much.
You're welcome.
Yes.